Good evening, everyone, and welcome to episode 176 of the On Air Advocate. Where at the On Air Advocate, we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. So for those of you who may not know me, my name is Tammy Flynn, and I am the host and producer of the On Air Advocate, and I am super excited if you are joining us here this evening or whether you're catching this on the replay. Now, as always, if you think any of the content we're talking about could be relevant for anyone on your network or your circle, please hit the share button and share the love with others. Well, obviously we have to recognize what is on all of our minds. And I'm just so, like I said, so grateful that I have two of my favorite docs here to talk about that with us and for us to share what is going on with COVID-19. And so today I have with me Dr. Zarinah, better known as Dr. Z, as well as Dr. Nicole Rochester, also your GPS doc. So ladies, welcome.
Thank you.
Thank you. Thank you for having us again. Always a pleasure.
Yes. Thank you.
And this is our first time getting to do it together, so I'm excited to be here.
This is actually a treat.
Yes.
It's like the tag team duo. And you know, there's so many topics, you know, from all of the lives that have been going on, you know, the Facebook lives, all the stuff we were seeing on TV. I know, Dr. Nicole, you were just kind of talking about some of it. You just have to zone out a little bit. You know, there's just so much news and it's just evolving and changing so much. But I think that, you know, first and foremost, you know, talking about the current situation of, you know, kind of where we're at. But, you know, do you think that for every time people are coming on, they really should be kind of hammering down into the hygiene stuff? You know, I mean, I feel like we keep repetitively saying that. Do you think that, you know, as the United States, like we're kind of past that now, like we need to start moving on to other action steps? Whoever wants to take that.
I think that we really need to be focused on the sheltering in place. And, you know, I'm really frustrated by the fact that I think today the president said something about, well, maybe after 15 days, we can consider going back to life as usual. And I'm like, no, so, you know, I feel like the country is getting a lot of mixed messages without getting political. I think that the doctors and the healthcare professionals need to be the ones talking about the medical care, and the other politicians need to focus on, you know, the stimulus package and all those other things. But you know, there's been a lot of misinformation. There's been a lot of information shared prematurely, and ultimately I worry that it's going to have a negative impact. So I think we can't stress enough the hygiene, and really the staying home is really the big.
I mean, I kind of feel like, are we on to that second phase? And I don't know if you want to take that, you know, yes, the hygiene, but like you're saying, you know, Dr. Nicole, like staying home. Like, I don't understand what people don't understand, but it seems as if they don't understand. Dr. Z, what is your thoughts on that? About the staying home?
No, I think, like you said, the staying home, I'm not sure that they don't understand it. I think it's just literally such a shift in their lifestyle and mindset. Some people are still, believe it or not, in denial. I think that's a huge part of it as well. And some people, as Dr. Nicole just mentioned too, as well, Dr. Rochester, is that there's some mixed messaging happening. And so, which is probably why our airways are so flooded. Hopefully a lot with physicians who are really trying to educate the population and debunk some of the myths that kind of surround this virus, so that we can empower people with information that is actually accurate information. I think that if we can get a handle on helping people understand the severity and actually giving them very clear things that they can do, even when it's difficult, and I think we can start to turn it around. But indeed, we can't give out, as Dr. Rochester just mentioned, I couldn't echo that better enough, is that we have our government who says things that really don't align with the science. And so that makes it a little confusing.
Yes. And I mean, I was talking to you guys before we hit go on this, just about in our state, you know, today our governor ordered basically shelter in place but our governor didn't like the verbiage on sheltering in place, thinking it's confusing to some what shelter in place means, but everybody else has been using shelter in place, and he's calling it safe at home. So it's supposedly the same thing as being, sheltering in place, but versus differently. But then, the other night I was talking with a group of moms. We were from all different states, and we were kind of giving our 2 cents for our states of what's going on. And I still have not found any criteria that talks about the difference between sheltering in place and being locked down. So, now we're saying safe at home. What does that mean? What is being locked down? What does that mean? What is the definition? Is it different? And so, as you guys were speaking about, things are very confusing. Very very
Yeah,
confusing.
I agree. And I think, whatever you want to call it, we just all need to stay home. And the message needs to be clear. I'm in Maryland, and our governor, I think, has done a phenomenal job in general, and he has given very clear communication. But today, in his latest, he does these daily updates. He fell short of issuing a shelter in place order. And in fact, he said, we're not there yet. And I'm thinking, well, when will we be there? Because we already know that's really the only thing that's going to stop the spread. And so I just, I don't know, I'm going to sit and wait. And I mean, myself and my family have been trying to do that, as much as humanly possible. But, I think the difference, and Dr. Zarinah, you can chime in, I think the difference between sheltering in place and lockdown, like lockdown, I think is what they did in like Italy and China, where literally like you're not supposed to go move at all, as opposed to, they're saying like if it's essential, if you need to go to the doctor, you need to go to grocery stores and things like that. So I'm not exactly sure, but I think that may be the difference between kind of safe at home / sheltering in place versus a complete lockdown where, there are police out on the streets that will stop you if you leave your home.
Right.
Or at least question you as to where you're going.
Right. And Dr. Z, I know that one of the moms I was talking to the other day, she's in the Georgia area, and she said per county, you guys have some things that have like curfews. Like some counties have a curfew, like things close at a certain time. Everybody's supposed to be home at that time. Some of the counties don't. Have you found that in your area to be in like where it's not over all of Georgia, it's all in these separate sections?
Yes, I have seen that as well, in kind of different counties where there's curfews. I've heard of one county, I don't recall off the top of my head, but it's in Georgia where they implemented curfew for basically the millennials, teenagers. I don't really find that to be highly effective, quite frankly, just because the other people don't have curfews. So I think it was an effort to kind of feel like, oh, we were doing something. But again, if you're consulting with physicians, clinical people in particular as well, not just the researchers, we all have to have a part in this. I think we can start to make sense of it so that when we're implementing political or social, construct to this plan, that we actually are doing it where it's going to be effective in a health-wide way. I definitely have seen it. Again, it can be effective if it's implemented everywhere or in that county and not just for certain demographics. In particular, when everyone is impacted, there's infants that are being, part of this as well. So this coronavirus is not, it doesn't discriminate. It absolutely does not discriminate.
Yes. And what I have also found, I guess, in our area is that, now that they've issued this, so it says only essential needs. It seems like every time they give a blanketed word, businesses and consumers try to make that fit into their box.
Exactly.
So now, okay, well, because Home Depot services heaters and water heaters and stuff for your home, they're considered essential. But then like we have like a tractor and factory place that sells also stuff like Home Depot, but they have farm food for animals, so they get to stay open. And then a bakery down the road, they make bread, and bread is considered an essential, so they get to stay open.
Oh, wow.
So my whole thing is that when we say essential needs, so you mean every single business that makes an essential need gets to stay open, even if they only have one rack with one thing on it, and that's where, our frustration, I guess here for me in my state is like, we are rapidly growing, and it's community spread. it's
Yeah,
not where we
all
know
the time.
any, that we
Yeah,
know any longer where
You
those
made a good point. That's kind of leaving it open to interpretation, and that's
that's
kind
right.
of the dilemma that we're having when you leave it open to interpretation. You hit it right on the head. From a global perspective, everyone is growing, in these numbers, and it's partly because of the, like, again, keep going back to it, but information. But thankfully, like platforms like yours, and others who are trying to, bring together minds that actually understand and know what's going on, so that the public can be a lot more, again, empowered. I so believe strongly that we cannot wait on governmental mandates. We
No,
absolutely have to self-mandate, because we are in this together. I can't stress that enough. And until we realize that, again, we talk about the asymptomatic patient as well, right? The people who are not symptomatic but are indeed carriers, and can then pass that on to someone who is a lot more vulnerable than them, perhaps, and then it becomes deadly for them. So
yeah.
we have to think globally. We have to think from a community perspective. I've had some unfortunate conversations. I've had some beautiful ones too, but some of the unfortunate ones just really hit home when I hear, a fellow citizen tell me every man for themselves. Like, we can't afford that mentality. You can't afford the mentality. The one that even said it, you can't afford that mentality.
right.
So until we can really stress the importance of this is us and not them, whatever them means to you,
Yeah.
we won't get a handle on it. But when we start to include ourselves in the solution, then we can get a handle on it a lot quicker. My
Yeah.
I
opinion.
totally agree with Dr. Zarinah. And I just want to add, she mentioned the asymptomatic, which is so important in the spread of this virus. And we have to remember that the incubation period is up to 2 weeks. And that means that you can be infected and not have a single symptom for up to 2 weeks. Now they say the average is, 2 to 7 days, but the bottom line is you can be exposed and be infected, and you're out here because you don't want to shelter in place, because you don't want to stay home, because you're being selfish, and you're spreading this disease unknowingly. And then by the time you finally start to feel badly, who knows how many, hundreds of thousands of people that you have infected. And they've demonstrated this, in New York, and some, where they followed individuals and they've been able to trace hundreds of infected individuals back to a single person. So we have to do our part.
And I
Yeah.
felt like, last week, one of my moms that was in our group, she's from Florida. And so, we were talking about, as a mom, obviously she's taking the precautions and staying home. She has a daughter with rare disease, so they're not going anywhere, but you have all these beaches. Like last week, did not some government want to just say there is no spring break? I mean, for all of us,
Oh my gosh.
New York is canceling Broadway. You know what I'm saying? Everyone's trips are being canceled, but we left all the beaches open. So now probably out of that,
Oh,
hundreds of people are going to come up infected. And I just think to myself, I feel like their governor, you know what I'm saying, should have taken ownership of that before spring break ever even started and canceled
absolutely.
everybody.
Well, that's exactly one of my fears. One of my fears is that when we have our leadership, again, we do need our leadership, even though I stressed again that we have to self-mandate. But when we don't have our leadership to kind of echo that, the problem is if you have this wave of safe at home, stay at home, right? If you have a wave of it as opposed to collectively, we're saying we're doing this as a country, as a community, as a state, as a city, then you have the waves of the infection spreading as well, because everyone is
Exactly.
not really doing the same thing at the same time. To give that incubation period of time to kind of do its thing and go, and then it's done. I might be oversimplifying this for sure. I'll give whoever argues that, definitely I'll give that to you to a degree. But when you can't argue that if I can fly in and out of New York, because the flights have not stopped, they're cheaper, right? People are saying
Yep.
probably you shouldn't do it, but you can fly in and out of New York and bring that back to Georgia. How many people are still flying for business or whatever, and that's still happening? How many people on the beach went back home to their respective states, because many of them probably weren't citizens of Florida, but
That's
then they
right.
go back to wherever state they were, and you start to see these surges that continue to happen because, again, we don't have necessarily a collective support in the leadership to mandate, even though we're stressing that you have to self-mandate. everyone is not going to take that responsibility on their own. Hence, it takes leadership from the healthcare system, from the political structures, from the business structures, leadership in all of those realms to be collective in a handle on this pandemic.
Yes. And something, I have a couple topics that I just want to run through. The first one is when we do hop all the way back to the very beginning, the hygiene. Don't touch your face. Try to wash your hands 20 seconds and out, you know, your medical scrub, bring along your hand sanitizer, do all those things. As you know, as I do mix within that rare disease world, and lots of moms and dads that are that are the cautious they need to be for their child, talking about the sanitation level, you know, where things need to be and things that people don't think about. Like when we go to the grocery store, obviously they hand you the wipe now, right, for the handle. But what about the groceries, if you're not wearing gloves, the groceries that you touch? Then you go to the cashier, and then the cashier puts them on the belt, and then the belt goes into a bag, and then that bag goes into your car, and then the car sits on your seat. And they're saying that, you know, this virus can live on surfaces for up to like 5 days. You know, so do we feel like with those type of extremes, some people are like, Tammy, maybe you're a little overzealous, you know, because I spray my seats in my car with Lysol. I wipe the stuff that comes out of the bag. I get rid of those bags. But I mean, I just can't see, like, okay, we're doing the handle, but then what is that going to do for us? Because everybody touched the product that's on the shelf. So, you know, like, I know that we're telling people the simple stuff, but I mean, if we were really to get real about the cross-contamination, isn't it much bigger than just washing our hands and not touching our face?
Yeah, I mean, it definitely is. And I mean, you know, at the end of the day, unfortunately, we can never completely eliminate our risk. And, you know, just being on social media and seeing what some of my friends are doing, you know, I'm seeing some people are doing nothing, and some people are leaving, you know, their non-perishable items in their garages or on their decks, you know, outside for 24 hours, 48 hours. Some people are, you know, wiping down everything before they put them in their refrigerator or put them into the pantry, you know, doing what you're doing, Tammy, you know, getting rid of the bags. I mean, I think anything that we can do, you know, to minimize the exposure is good. And I'm definitely much more cognizant of those types of things, you know, because like you said, we're touching things every day, all day. And yes, those packages that we're buying from the grocery stores are potentially contaminated. So I think we all just have to do our absolute best, but we're never going to completely eliminate our risk. And so the hand washing is that even if you have touched something that's cross-contaminated, if you're doing a really good job washing your hands for at least 20 seconds with warm water and soap, or, you know, alternatively using hand sanitizer, then the idea is that even if you contaminate it yourself, you know, now you've gotten rid of that virus before you're eating or things like that. But you can get really obsessive with it. I mean, I find myself getting a little obsessive.
Dr. Z, what are your thoughts on, I mean, aside from what they're saying, are there extra things that you do that you feel are like vital?
I almost don't want to share it because I might be on the spectrum.
We want to know. We want to know.
Some people might call me excessive, but you know what? Honestly, right now, I'm going to share it because you asked and I love you. But I will caveat to what I do. It happens to be because I literally see patients that are between the ages of 50 to 100, and they're critically ill oftentimes. So I take extra precautions in my process. Which includes, for me, I do very similar things to you. And again, I'm not saying everyone has to do, but if you're I'm the loose cannon in my home. My husband and children are home all day, every day, you know, holding it down, you know, and I'm the only one in and out for the most part, you know, and going around potential. I say everyone's positive until otherwise noted. And so I have to move in that way, especially with patients who are critically ill, have all these different chronic illnesses. So all of that said, I go to work in my scrubs, I gown up, I go, you know, goggle up, gloves, masks, so on and so forth. I discard of all of that at the hospital. When I come home in my scrubs, I strip it in the garage,
Yeah.
and and then I go in the home with in my birthday suit, and then I, well, sort of robe, of course, go straight to the washing machine, and I go straight to the shower. I have young children who love to run to mommy when they hear the door open. But, you know, it took me almost a week, but now they don't do it, to not run to mommy until I come out the shower. So it is a process, but I just feels like I have to take an extra effort because I know that I'm exposing myself every day, and potentially exposing myself, obviously, and in my family as well. And I just have to take those extra precautions. The average American, I don't know that you necessarily have to do that unless you're truly in and out. But if you're staying at home, hashtag stay at home, please. You probably don't have to do all of that.
Right.
But indeed, you know, hand washing, I still say hand washing and soap and water is still key. One of my reasons is I think when people put sanitizer on, they tend to do this,
Yeah.
but that's it. When you wash your hands in soap and water, most people are gonna probably get up to the wrist at least, and you just do a better job. And also there's a scrubbing and exfoliation kind of aspect that goes along with that. And indeed for other things, even we know like E. coli and other things, it just does a better job with soap and water anyways. Alcohol or, yeah. So I will say, you know, the sanitizer is like, I can find it anywhere. Don't miss, you know, don't wash this is going to do a world of good for most Americans.
I think you said washing your hands is going to do a world of good, right? Oh, she might have froze. She
Uh-oh.
warned us beforehand. Dr. Nicole, that she.
Yes.
Are you back? You froze. Well, I think she was saying to wash your hands, right?
Yeah. Yeah.
I think I am.
And I agree.
But those are some extra steps. And I do think if people are, you know, still working every day, if you're at a grocery store, if you're in that, I do think you should take your stuff off when you get home, you know, and shower right away, because you are around all the elements all day long. It is, you know, just like they're talking about grocers, gas stations, all those things. You're on the front line of the consumer.
Yes.
You know, of what our needs are, and so treating that the same. Now I know that the both of you, you know, have a lot of synergy on caring for the elderly, you know, and that's a passion, you know, for both of you guys. How are they dealing? I know, Dr. Z, you're more on the front line with still seeing patients, right? That way because you're seeing the elderly population. And Dr. Rochester, you're advocating for them, correct?
Correct.
You know, on those ends. Are you seeing an influx? Does it seem like, you know, that you're seeing more sick patients? Does it seem as if more of them are staying home? Families are becoming, you know, their caregivers coming in. You know, have you had any that have decided to remove out of, I know like the nursing home type assisted living facilities seem like they're a very hot topic, you know, lately, with infectious sites. Have you had anyone take their loved one and decide that they were going to care for them at home, instead of in that predicament? Because now, like here in Wisconsin, we've shut down all of our nursing homes. So even if you're the patient's loved one, like there's no visitors at all. You know, no visitors. I don't know if
that was mandated across the board. Yeah.
Okay, was that everywhere? Okay, yeah, because
Yes.
that just happened. Was that last week? That happened. So have you seen, you know, loved ones doing that with their parents, or, you know, kind of a change in atmosphere?
Yes and no. Yes and no. I mean, there has been a percentage that want to take their loved one home during, I guess now, you know, like either they try to do it officially or temporarily. That's a little bit of a difference. So because we didn't typically see that, I won't say it's the majority. It's not even 50%, but there are a percentage. Some parents, I mean, family members are just really nervous about the fact that they can't go in to see them and put their eyes on them. So that makes them a bit nervous. There's a lot of reassurance that has to occur on our part to make sure that the family feels still involved and understand they're living well. To answer the first part of your question, yes, people are coming sicker. They're coming sicker to our facilities compared to, say, a couple of months ago. Quite frankly, that's always been the case, though. They don't always come as stable, but we are seeing that more. And one of my biggest concerns is that sometimes the long-term facilities or the subacute rehab facilities maybe not be as equipped as an acute hospital, with as many resources in different disciplines. So that becomes, so sure I take care of that loved one in the way that I like to. I say that doesn't mean they're not getting taken care of. What it does mean is oftentimes we have a lot of readmissions to the acute hospital, because we want to make sure that they're in good care and good hands, and it has all the resources available to them. So it's like a little bit of a ping pong when we find a patient who has, say, a respiratory diagnosis and they're a bit unstable. In the past, they may have stayed a little longer, honestly, in those long-term facilities or that subacute rehab, but now people aren't willing to take that risk because, again, they could be COVID-19 positive. And for that population in particular, as you just mentioned, over 65, and they often, most of those patients honestly have 5 or 6 diagnoses in what I call polypharmacy. So they may be on 8 to 10 different medications. All of these things play a role into their immune ability, their ability for their immune system to fight whatever is happening, because they're then now immunocompromised. So yes, to the increase in hospitalizations. Yes, to some people wanting to keep their loved ones, but bring their loved one home. Not as high, I think. And yeah, keeping, no visitors. And that was a fight because family just, even though they knew what was going on, that was the reality and they couldn't come. So that was a fight, but we're gotten a lot better by that.
Yeah, and I would add, from my perspective as an independent health advocate, I'm extremely concerned. When I wear my physician hat, I absolutely understand why the visiting restrictions are in place. And I agree that, just like we've already talked about, those are methods and measures to flatten that curve, to stop the spread. But as a health advocate and as a former caregiver to my own dad, I know how important it is to have a family member at that bedside. And especially now that we know that the healthcare providers are literally being stretched. And on a side note, I'm sure you, Tammy, have seen, I know Dr. Zarinah has, the Get My PPE hashtag. So, unfortunately, our healthcare providers are not being protected. And so they are going to get sick, and we're going to see that workforce shrink. And so now we have these vulnerable elderly patients with underlying diseases, critically ill in these hospitals with COVID-19, with, not as much attention because of, the workforce is going to be stretched to capacity. And then they don't have that trusted family member at the bedside who can say, something's wrong, I need you to get in here right away. My mom's not acting right, or my mom's having trouble breathing. Yeah. And similarly, in the rehab facilities, they're not equipped to take care of really sick patients. Every time I've had a family member or a client go from the acute hospital setting to the rehab, you immediately notice a change. And I'm not saying it's worse care, but it's different care. They're not getting vital signs every 4 hours. They're not on a continuous oxygen monitor. That's not what the purpose of a rehab facility is. And so, like Dr. Zarinah said, the hospitals are under all this pressure to free up beds so that they can make room for more COVID-19 patients. Right. And so they're going to be prematurely discharged patients. And then it's like a perfect storm. There's not going to be a family member there to say, I don't think my mom is ready. And then these patients are going to be discharged to, subacute rehab facilities. And then they're not going to have, a trusted family member at their bedside to be able to really monitor them. So I'm literally holding my breath.
Right. And to advocate for them. And in Dr. Nicole, we've talked about this so many times when we've talked about elderly care, when we've done other segments, is just, you feel at any point in time that you put your loved one in any assisted, facility or rehab facility, that you need to be there like every hour.
Yeah.
Making sure, because they are so short on staff to begin with. So now I can't imagine the amount of pressure that is being put on, you know what I'm saying, the care workers in these facilities. Now, you know, is the hope, do you feel like the hope of having these ships come in and kind of help up, and the National Guard, you know, to be there to kind of lighten that load? The only thing is, I'm not sure, are they all trained in that way, you know, that are coming in?
Well, you know, I mean, a lot of physicians now are being
I
trained,
think that's the goal.
crash training
I'm not in that.
to do things that they are not trained to do, you know? And so that's just going to be the reality. I mean, I'm not on the front lines anymore. You know, I'm non-clinical for the most part, but honestly, I would not be surprised if I get, you know, a call or an email asking me to, you know, to chip in. But there are pediatricians like myself who are being trained in adult ventilator management, you know, in the
Right.
case that they may have to take care of adult patients. So, you know, I mean, it's kind of like wartime, honestly.
Yeah, if we're being frank about it, I think I completely agree with that. There's actually already happening, so it's not even a matter of it could happen. I have a colleague of mine who's a dermatologist who's been asked to go to the ER and help out. You know, it's a dermatologist.
Wow.
So it's happening already. Actually, it may not be as widespread. It's probably in these more concentrated cities, but indeed, you know, we're not on the curve of a downward curve. So I want people to be very clear about that. I feel like as a week goes by and another week goes by, people are kind of, obviously, like I said, still a little bit of denial, or they feel like, oh, okay, well, another week we should be for good. And it doesn't really work like that. In particular, if our behaviors, again, from leadership down, is not consistent and not robust enough. So it takes more than just the idea that time passed, so now we're okay because time passed. Like time, they say time heals all wounds. It doesn't really work like that if your behavior doesn't change. But different things don't change in that regard. So I hope that the National Guard point is that, you know, yeah, to help stabilize certain things, but I'm not exactly 100% be honest. I'm a physician, so I don't know 100% why I'm seeing tanks in cities. I've seen it. I don't know. Maybe you all have seen it as well.
Yeah.
I'm not exactly sure what they're about to do. I can't honestly speak to that, but obviously there was a need. Someone thought they should bring tanks in the middle of America cities. So
Yes,
we
when
shall see.
we have one of our facilities, like a more of a community-based senior living, huge community, that someone passed away. So one of our 5 that have passed away from COVID-19 was in that. And so
Condolences.
now they have sent the National Guard to that facility because obviously, you know, no loved ones can be there. And if staff is short, because now obviously the staff was exposed. So, you know what I'm saying? Those that were exposed had to be quarantined. And so they're there to be extra support and help, you know. But like you were just speaking to that, you know, and Dr. Rochester, you're probably correct as well, that you could get called up. You know what I'm saying? I mean, you have some of the
Yeah.
technology, you know what I'm saying? You have some of the information, you know, you have
The doctor.
yeah.
Yeah. And I mean, it hasn't been that long since I took care of patients, just a few months actually.
Very much a doctor. We had the same training.
Like riding a bike, right, Dr. Zarinah?
Right. You know, to do those things. But you know, I can just say just the concern, you know, for these elderly patients. But that brings me to my next question and point, and I want to see if you guys have felt the same way from having a platform that really speaks to our different abilities community. For, you know what I'm saying, for the most part, those from everywhere from intellectual to mobility issues, all of those things, chronic conditions, rare disease. I feel like every time something's presented by a governor, by, you know, our government, by our president, by anyone, it's never really directed to this population. Like, you know what I'm saying? So like all these kids got let out of school, right? No one's in school. Okay. But you have all of these kids that were in special education that, you know, may have a cognitive, you know, disability, may have a physical disability, whatever it may be, you know, and they maybe got PT and OT and speech at school. They had a one-on-one aide or teacher that helped them, you know, do their work, which was modified for them. And you have all of them out of school now, and there's no therapy. My son this month, between this month and the first week of April, has had 18 doctor appointments canceled. Okay, so
Wow.
they are not doing therapy. They're not doing treatments. He's not getting leg treatments. He's not getting neuromuscular treatment. You
Yeah.
know, everything has been canceled. So, you know, I feel like this population and the parents that have to try to figure it out. I mean, obviously I'm a little more versed, you know, my son's 23 right now, you know, going to be 23. And so I've had a lot of years, but you have these parents that have chronically ill children or, you know, have significant delays, you know, and now they're sent home and they have no PT, they have no OT, they have no speech, they have no
Right.
mobility help. And I feel like I have not heard one broadcast that's addressed it, you know, that has addressed like, well, what's going on with, you know, with this population or the population that has mobility issues with maybe transport, right? Getting around, what things are closed, who's there to help? Maybe they don't have an everyday care worker, and maybe they're not set up a facility. Where is their help? You know, I see all the big things like call 1-800 for rent, call this if you can't pay your
Right.
electric bill.
Right.
You know, I mean, because there are a lot of you know, even young adults that maybe, you know, partially, you know, live on their own or live on their own that had, you know, a little bit of assistance, you know, but also got outside coordination from their communities. And I feel like so many of those things are being canceled, you know, and where is that support? So have you guys heard something different, or do you feel, I do feel like I'm kind of living in the twilight zone in so many ways. I'm like,
Yeah.
we just kind of
I
forgot.
mean, you're not wrong. Yeah, you're not wrong in that the resources are a lot more limited in terms of the physicality of it. As a physiatrist, for those who don't know, I am, you know, sports medicine trained and fellowship trained in integrative pain management, but my base of my residency and training is in physical medicine and rehabilitation. And it's exactly that population you're talking about across the gamut, be it a mobility issue, spinal cord, you know, bifida or spinal bifida, all the sort. And I say that to say, believe it or not, and I think it takes people maybe calling up to their respective therapy programs or their physician even, because there's a lot more services out there potentially that we think there are, even in this space. Some home health services are actually still ongoing. Now, granted, that's an iffy thing, right? Because you don't know where they've been and they're coming to your home.
Mm-hmm.
You know, how do you monitor that interaction? Some people feel like, well, that's better than not. I don't know that 100% agree with it, but I do understand, and I'm very sensitive to the idea, the fact that, like you said, those parents, you know, are kind of at a loss. Like, what do I do? And also, the telehealth community is increasing. And luckily, I would say the government, as well as at the state level, they've relaxed a lot of the red tape, I guess you can say, to allow more telemedicine visits to occur, even if you didn't necessarily have the license, the malpractice or the ability to do it before. And so a lot of our practices, medical practices, excuse me, are increasing our availability and accessibility to populations just like that. Because you may have a therapist on one end, just like we're sitting here now, and they may put that child on the other end of that video and still be able to coach or instruct and help the parents in a real-time manner. So at least they don't lose complete, you know, or get too much behind, or they can still have a sense of momentum towards something that's a consistency and a normalcy for that child, or it could be an adult, of course, as well. So I will say this time is allowing us and forcing us to think a little bit outside the box, get a little bit more creative and innovative with how we reach the people. I always say, even though we're social distancing, even though I don't really like the word, I prefer physical distancing.
Me too.
I think that doesn't mean you have to disconnect. We have to stay connected, and that's one of the ways that we can do so as a healthcare system, but also with our loved ones as well. Because someone made a comment in our comment section, I just noticed that the anxiety, depression, and even abuse may be increasing at this time. So that's a very good comment that was just noted in our comment section. And I hate to quote Trump per se, but he made a point to say, you know, the cure may be worse than the disease. And what he meant by that, or at least what I gathered from it, was that the aftermath of what's happening, you know, is going to be really, really, it's not just the disease in itself, right? It's not just the coronavirus in itself. It's everything else that comes with that, that we had to halt or redirect or pivot because of it. That is the impact, and that it won't be a snapback. We're going to have to really put resources in place, community resources, social resources, financial resources in place to help people. I'm not talking about financial recovery per se, but humanly recover, socially recover, familially recover, because it won't be a snapback for many of those families that you just described, Tammy.
Right. I think that across the world, it won't be a
Yeah.
snapback. I mean, you can't take away everything. And then it's like when you're trying to reintegrate it, you know, I mean, the people have to build up money to be able to service, to, you know what I'm saying, utilize all the places they closed. And I mean, there's just, as we
It's a
could go on
trickle
forever to
effect.
talk about, yeah, that ripple, you know, effect of everything that's going on. And I know, Dr. Rochester, you know, obviously your base started as a pediatrician. And so I'm sure that you're connected in that world so quite a bit. Have you heard any voice from pediatricians, you know, with this, you know, or other places, establishments that you have been at before, any other offices, you know, that how that's going for, you know, in the pediatric realm, you know, of things. I know there's a lower case
Yeah.
rate of, you know, babies and kids that are getting this, but there still are some kids.
Oh, absolutely. And I think that's, you know, that's one of the messages that I think may have harmed us a little bit is, you know, initially there was a lot of talk about, you know, oh, you know, you don't have, not, they didn't say you couldn't get it, but they just kept focusing on most of the people who are seriously ill and are dying are older people. And I think that's part of why some members of the younger generation didn't take it as seriously. And I'm not just talking about the teenagers and the 20-year-olds, even 30-year-olds and 40-year-olds. But we are seeing it among our pediatric population. I have been in close touch with my pediatric colleagues, and we're in, you know, Facebook groups together, and they're reporting cases. There have been infants that have been impacted. I know in China, at least 1 or 2 infants actually died from coronavirus, you know, so we're still learning about China's experience and Italy's experience and South Korea's experience.
Right.
So this disease absolutely can and does impact children. And so, you know, and we know that they can also be, you know, either mildly symptomatic or asymptomatic carriers. So that's a huge thing, you know, that we have to consider, especially in households where you may have a multi-generational household. Maybe, you know, you as the parent, you have your young children, but you also have your older parents. That goes back to what you said earlier, Tammy, about people moving their parents out of the facilities. And I know of a few people that have done that, but you have to really be careful with that too, because if you have young children who are, you know, just naturally, you know, they're kind of germy, and then you put them in contact with your 85-year-old mom, you know, that can be an issue. But pediatricians are also being impacted. You know, many pediatric offices, unlike some of the adult offices, already had like separate sick and well waiting rooms. And so I think in some ways the pediatricians may be adapting to this pandemic a little bit easier because some of them already had their offices set up that way, or maybe they see sick patients in the morning and well patients in the afternoon. But, you know, many of them are, you know, closing their primary care offices, doing a lot more telemedicine, as Dr. Zarinah just talked about, or only opening for, you know, emergencies or urgent visits. You know, they're doing a lot more management over the phone and really only bringing people into the office if it's absolutely necessary. So, you know, a lot of parents are upset about that because they have, you know, they may be missing some of those well child visits. They definitely are trying to get kids in who need vaccines. But otherwise, you know, if you just have a 2-year-old well child check where we don't do any vaccines, you know, assuming you're caught up, those are not considered essential right now. And those appointments are being canceled because, you know, the doctors, whether they're pediatricians, internists, we have to focus on sick patients. We're, you know, trying to keep patients out of the emergency department, and we don't need to clog up the doctor's offices with the well kids or the well adults right now. And of course, we don't want to expose them to the sick patients that are coming in with concerns, whether it be COVID-19 or some, you know, life still goes on. People are still having diabetes and hypertension and heart attacks and strokes. So, you know, we just have to be cognizant of that.
Now, the numbers, we talked about this a little bit before, but I'd love you guys to kind of break that down. You know, when we see these numbers that come out from the CDC every day in our state of how many people have it, how many people have been tested, how many people have passed away from it. I know we chatted a little bit about this before, but so people understand where that accuracy is, that it may not be quite as accurate, you know what I'm saying, as we think, because of lack of tests and things like that. And you might see a big upswing one day, you know, because maybe your state got more tests. Can you guys speak to that a little bit?
Yeah, I can speak it to it from a clinical perspective. One of the things that we see, clinically speaking, is, again, a lot of the asymptomatic patients are still not necessarily getting tested, which in general sense, I kind of understand that. But then you may have some patients, when we're going off a criteria that is actually ever moving, as a kind of a moving target in terms of what is considered the screening questions per se to ask. And if you fail the screen, like 3 out of the 5 questions were not, yes, then maybe you don't get the COVID testing. Doesn't mean you don't have COVID-19. It means that you didn't get 3 out of the 5 questions correct. And what we understand, and increasingly are starting to understand more and more, is that cough is not necessarily going to be one of your symptoms. Even a consistent fever may not be that. You could have intermittent fever. You may even have abdominal symptoms instead of high respiratory type of symptoms. So that's kind of where we kind of miss some of the mark. Hence, if you go to that point that you just made, we're going to miss some of those people that are going to get tested. Hence, the numbers that you see, I really say you have to take it with a grain of salt. Because for those very reasons, you have the asymptomatic population who are not getting tested pretty much whatsoever. You have healthcare workers even who are not getting tested, even if they've been exposed on a day-to-day basis. They keep loosening some of the criteria. Before it was like, if you're a healthcare worker even and been exposed or potential exposure, they wanted you to basically quarantine. Now they're saying, well, as long as you're not as long as you can be fever-free without using an antipyretic, medication for 3 days and come on back. Why are they really saying that? Not because that's the best thing. They're saying because they need us. And as a physician, I get it. But as a mother and a wife and a human being who wants to be here, I don't get it. So it's two parts of me that is conflicted indeed. And yet I understand that the need is there for healthcare providers to not disappear, but for us to be there. But indeed, #we need PPE so that we can be in better positions to continue to go out there on those front lines to do that and not compromise not only our health, but our lives.
Right.
Absolutely. Yeah, I completely agree with everything Dr. Zarinah said. And like you said, Tammy, we really have to, the numbers are just reflective of testing. And, some of the other countries like South Korea, they had much more widely available testing. And so they were able to test, asymptomatic people. And that helps you with the sequestering and, the self-quarantine and all of that stuff and identifying contacts. And I don't think we're ever going to get there in the US. We just don't, we missed the boat. We don't have enough tests. And there are a lot of other forces, like Dr. Zarinah said, that are influencing who's tested. They literally keep changing the guidelines almost every day, sometimes several times a day. And so, when you do see those spikes, it typically just means that your state finally got a shot of testing kits. And and also the same thing goes with the death rate. Early on there was all this discussion about the death rate from COVID-19 and how that compares to influenza. And while we definitely still think and know that it's, more fatal, those numbers are skewed because our denominator is skewed. So we don't know how many people are infected with COVID-19. And so if we're counting the number of deaths based on the people that are tested, but the people that actually have it are much bigger than that, then it's going to make it, and I'm not minimizing it because this is bad, but the numbers that you hear on the news every day are really inflated. And we're never going to know what that true denominator is.
Right. And so hopefully more tests will come in, hopefully the protective equipment, because I did hear something like that today. And I was like, did I hear that wrong? Like they're talking about that possibly if you get it, you might not have to stay home as long and you wear a mask. And I mean,
Tammy, they're telling doctors to put freaking bandanas on their faces.
Yeah, I saw that in writing.
I mean, I'm just flabbergasted. Bandanas.
I will say in Georgia, Kemp was live today and he made the announcement. I guess we'll have to wait and see if it comes to fruition, but he made the announcement there was like about 250,000 or so PPEs that were supposed to have shipment coming in later this week, or, but again, then it turns into access. Like, will that get trickled down to the long-term care facilities and the subacute rehabs where we have so many acute respiratory patients who just needed to free up a bed at the acute hospital, so all the PPE goes to the acute hospitals that are major, like, you just have to wonder. You just don't know. We have to wait and see, I guess. But indeed, I can't tell you, there's thousands of my colleagues, because I know hundreds of them personally, that we're out here shopping our own PPE. Because we cannot wait for it to show up, and we can't not treat our patients either. We have to continue to treat our patients. So we're out here trying to collectively and collaborate and coalition and things like that to say, hey, where'd you get your stuff from? We're, like, personally out of our own pocket, so to speak. And we will continue to do that if we need to. But again, it shows you the magnitude of that should not necessarily be happening. That shouldn't be happening.
Right.
But we do what we have to do, because again, we're in this together. But it gives you an idea of like where we are. Like, this is a real thing, and PPE is a big problem.
Right.
Yeah.
And so everyone doing their part, as we talked about in the very beginning, and just as simple as, if you don't have to be on the front line, staying home.
Please stay home.
Right.
I totally would.
Yeah.
And Tammy, if I can add it for your listeners, if you have PPE, because I didn't even realize this until now, but construction workers, and there's other industries that use N95 masks, and most of the dental offices, and ophthalmologists, a lot of these other offices, these other specialties, they're not seeing patients right now. So we implore upon you, if you have access to these N95 masks, please, find a way to get them to your local healthcare facilities. I've seen posts on our Nextdoor app where, nurses and doctors are saying that in the community, neighbors have come together and are dropping off masks, on their doorstep.
Oh, that's beautiful.
So yeah, I mean, that's heartwarming.
Like, give them my address.
That's what we need right now. We need everybody to come together.
Need my address. Yeah, that's amazing. That's beautiful.
Yeah.
I think I have 3 masks at my house. Could that help you? They're just 3 disposable ones. That's all I have.
I mean, in your community, that may that may be necessary eventually.
It may be necessary. You never know.
For all of that. And the last thing, kind of in wrap up, speaking to that comment that somebody made, I'm not looking at the Facebook comments currently right now, but when it comes to the anxiety level and the stress, and I know as Americans, the whole thing is like, we're voyaging forward and we're all in this together, but I mean, this is pretty traumatic. I mean, though we're all in it together makes it a little bit better. But, I've seen a lot of posts, as you guys have, talking about the issue, talking about what's going on, doctors and, government coming on. Then I've seen a lot of my business hustler, people on my Facebook and all of that. Get your side hustle on. This is time to get organized, clean your basement, start your business. But I haven't seen as much out there in the area of support. You know what I'm saying? Like mental health. Like, we really need to look at this. I mean, not only do you have all your kids at home, and everyone's situation is different, whether you're a single parent, whether you have a spouse, whether you have kids with needs, whether you're elderly and living alone, and you're still at home and you don't have a family. I just feel like there is so much mental support that's needed. And I wasn't sure if you guys were in tune with any agencies or places that maybe are lending to folks right now.
I actually do know quite a few psychiatrists who are opening their virtual doors for, definitely taking on patients new and established, to make sure that they can kind of maintain during this time. Like you said, some people have, they get anxious around this time because of like just the whole idea of it, depression, even suicidal ideations, different things like that. So there's definitely doctors out there. If you need me to share that in the comment section once we're done here, I can definitely do so. But there's definitely psychiatrists around the country that are, opening their virtual doors to definitely try to mitigate some of this, so that it's not like as bad for patients who can't get into their psychiatrist right now because the doors are closed. Mm-hmm. But again, for really a lot of different mental health and otherwise, a lot of telehealth doors, virtual doors are opening. So I urge you, if you're listening to us this evening, to reach out to your physician, reach out to your health department, and find out who's open, who those people are in your local community, because it may be more out there in that telehealth world than you may realize, and people just don't know to even look.
Yeah.
Okay.
That's very true. And I've seen other, practitioners that specialize in meditation, doing like free, offering their services for free, or doing like audio, there's apps, or I've seen a lot of stuff actually on social media, group therapy. I think Talkspace, I think they're doing, I don't know if it's free, but either it's free or they're doing some huge discount, which is one of the virtual therapy platforms. So there definitely are people stepping up to the plate. And like Dr. Zarinah said, you may have to do a little legwork to find it, but I think that it hasn't been ignored. The impact on mental health has not been ignored.
Yeah, I really am proud of that community. Honestly, I have seen quite a bit, from the alternative options to, just the traditional ways that people think about it. Whatever you kind of fit, I've seen it all. And I urge people to, I think, in that mental health space, because even as physicians, we need it. We sometimes, especially now, it's hard to kind of like remind yourself to do it.
Yeah.
I engage in those same, platforms that Dr. Rochester just spoke of, in terms of yoga online and things like that, or the meditation online and things like that. It's really critical, even for your children who are kind of anxious about their lives are just not quite as normal anymore. Encouraging laughter, encouraging song and singing and dancing is very therapeutic mentally as well as physically, of course. I encourage us to, pull away from the social media, pull away from being inundated by all of it every day, all day. Allow yourself and force yourself to take, an hour every couple of hours to do something that's unrelated to coronavirus.
Yes.
That self-care piece is so, so huge. I have to remind myself of that as well, because even after I leave off of this broadcast, I'll be probably working a little bit more, a little longer. But, we have to force ourselves to do those things. And that's one way that we can do it. Remember the laughter, remember the song, the dance, all of that is critical. It's really, really critical.
I agree.
And Dr. Rochester, if you have any of those resources too, I would drop those below.
Sure.
Of any, networks. But yes, and I have seen more parents, a lot of mothers and daughters that have started their TikTok together.
Yeah.
So I know that social media, that's what I've seen a lot of. I've seen a lot of, I'm like,
I love it.
Everybody's got a dance TikTok and trying to make fun, activities and do these virtual things. I was telling some friends, I'm like, what? We all need to do like bingo. Like everybody makes it hard to have 100 people playing.
Is it I think AMC or one of the big movie people, whatever, they allow you to kind of like watch together like a new movie that just came out.
Oh, yes.
It's so many different things out there. Just whatever you think you want to do is probably actually out there. So Google it and get engaged and try to think outside the box. We've been doing indoor tent, camping. We've been doing a lot of different things for our children just to, make it fun and try to keep them, off their mind too. And it helps us as well as parents. But yeah. I
heard they said to limit yourself to no more than 1 hour of exposure to listening to it per day for the coronavirus.
That's enough.
1 hour.
I think that's enough if you can get away. Yeah, I personally obviously cannot, but yeah, if I wasn't in my field, I think that's more than enough.
Yeah.
1 hour to stay updated. Well, I thank you guys so much. I know it is late. It's like bedtime. And I thank you guys for staying up with me for over an hour plus with you guys. If you guys can drop those resources, but your resource is always here. So I know that you both are fabulous. If anyone has, all other questions, things that they'd like to reach out to you, Dr. Z, what's the best place to do that at for you? Do you find for if someone wants to reach out?
So you can follow me. Please follow me, click like and follow me so that you can stay updated with all things sports medicine, integrated pain management, actually advocating for your health as the MVP, the pain freedom physician at Dr. Zarinah across all social media platforms. That's DrZarinah. And then also www.drzarinah.com. That's how you can get in touch with me as a telemedicine consult if you need it, as well as blogs and such, whatever can really help you navigate for your health and wellness.
Thank you. And Dr. Rochester, how could people?
So I am on all social media channels as @YourGPSDoc. And I, as an independent health advocate, I primarily work with family caregivers, and I help them navigate the healthcare system for their loved one. You can also go to my website, which is yourgpsdoc.com. There's lots of free information, blog. There's a contact page if you want to learn more about my services, if you're interested in hiring a health advocate.
Awesome. Well, all the information will be there. We'll drop some of those other links and stuff below when we are done. Thank you guys for being here with me tonight. I so appreciate it. I am so blessed to have you guys within my health circle. You guys are so wonderful.
Thank you, Tammy.
With
Thank you for
that,
having us.
we are all in this together. If you want to know any more information about the On Air Advocate, head over to onairadvocate.com and all of our resources are there. Until then, I will see you guys tomorrow afternoon, I think. Again. All right. Thanks, guys. Happy Monday. Bye-bye.
Bye.